Namaste, Om Namah Shivaya. Have you ever wondered why so many young women today are struggling with irregular periods or menstrual cycle, sudden weight gain, stubborn acne that just don't go away, and this could be signs of something deeper? Today we are diving into one of the most common yet misunderstood health conditions affecting millions of women worldwide, PCOD and PCOS. This video will include the symptoms and causes of PCOS and PCOD, and also I will be discussing about the role of diet and yoga to manage PCOD and PCOS. Before discussing about the effect of yoga or the yogic management of PCOD and PCOS, we should have a brief idea what PCOD and PCOS is and their causes and symptoms. Then only you can design the yogic practices or the modules of yoga practices to address specifically PCOD or PCOS problem. Let's talk about PCOD. PCOD means polycystic ovarian disease. PCOD is a condition where ovaries release lot of immature or partially matured eggs, which eventually turns into cyst over time, and this leads to irregular periods, weight gain, hair loss, and infertility. But PCOD is less severe than PCOS because PCOD can be managed through lifestyle modifications and regular exercises and yoga practices. So the key symptoms of PCOD are irregular menstrual cycle or periods, then weight gain, acne, then mood swings and fatigue, then difficulty in conceiving due to irregular ovulation or due to immature or partially matured eggs, then hair loss. So these are the symptoms of PCOD. So PCOD, as I told earlier, is usually manageable with healthy lifestyle changes, diet and regular practice of yoga, or you can practice other exercises also. Let's discuss about the causes of PCOD. So first is genetics. If there is a family history of PCOD, then you are at high risk of having PCOD. Unhealthy diet, because nowadays we used to consume lots of junk food, the fast food, packaged food, which are having adulteration or chemicals mixed with this kind of foods. And we also don't know the fast foods are fried in the oil, how old this oil are. So that's why this kind of foods are creating hormonal imbalances. So better to avoid this kind of foods. Also the processed sugar, which can trigger the hormonal imbalance. Then high insulin level. So insulin resistance leads to weight gain and it can worsen the problem. Then in today's era, one of the most common factor or cause or leading cause for PCOD is stress. It may be family stress or it may be occupational stress. So stress can affect your hormonal and entire endocrine system, and it can lead to hormonal imbalance, which can cause PCOD. So we need to have a proper work-life balance. Another important factor is or leading cause is lack of physical activity. A sedentary lifestyle or lack of physical activity always lead to weight gain, and it can also lead to hormonal imbalance. That's why you can keep yourself associated with yoga practices, or you can keep yourself associated with any kind of sports or any form of exercises. So as I told you that PCOD is less severe than PCOS, so with proper lifestyle, diet and regular practice of yoga or any other sports or exercises, it can be managed. Now let's talk about PCOS, that is polycystic ovarian syndrome, which is more complex and more severe than PCOD. PCOD is linked with lifestyle and ovarian dysfunction, but PCOS is associated with the disbalance of endocrine system and metabolic disorder. But the root cause of both PCOS and PCOD are hormonal imbalance, insulin resistance, stress, and inflammation. So why PCOS is more severe than PCOD? So first we should know what is PCOS. So PCOS or polycystic ovarian syndrome is a condition due to hormonal and metabolic disorder which is not only affecting the ovaries but also affecting the other system of your entire body. That's why it is more severe. PCOS occurs when the ovaries are producing higher than normal level of male hormone, that is androgen, which is disbalancing the reproductive hormones, and it is preventing the ovulation. So the women are having irregular periods or missed periods, delayed periods, weight gain, not releasing eggs regularly, that is anovulation or ovulation problems, many small cysts, fluid-filled sacs with immature eggs may be visible on ovaries due to lack of ovulation. So this is PCOS, which is mainly due to the production of high level of male hormone androgen. According to WHO, 6 to 13% women are getting affected due to PCOS. Also, PCOS is one of the most common cause of anovulation and a leading cause of infertility. PCOS is associated with other health conditions in the long run, which can affect you physically, mentally, and emotionally. And one can get PCOS anytime after puberty. So PCOS can cause hormonal imbalances, irregular periods, weight gain, excess androgen level, and cyst in the ovaries, irregular periods, usually with a lack of ovulation, and it makes it difficult to become pregnant or conceive. That's why it can lead to infertility. And according to WHO, PCOS is the leading cause of infertility. The key symptoms of PCOS are irregular periods, missed period, delayed period, weight gain, acne, excess hair growth on face, then in the entire body called hirsutism, then hair loss, weight gain, darkening of skin, then infertility. Women suffering from PCOS are at high risk of getting diabetes and cardiovascular disease. Now there are some possible causes of PCOS. The first one is insulin resistance. Insulin resistance means your body becomes resistant to insulin. So pancreas is creating or producing high level of insulin. Due to high levels of insulin, the ovaries are producing more male hormones like androgen and testosterone, which are disrupting the ovulation process, that is leading to anovulation, and which again causes infertility, or which leads to infertility, and thus causing the hormonal imbalance due to high levels of male hormone, that is androgen. Then genetics. If there is a family history of PCOS, then you are at high risk of getting PCOS. Many with PCOS can have low grade of inflammation, and again which is triggering the bodies or ovaries to produce more male hormones. Despite the name, not all women with PCOS have ovarian cysts. Still, PCOS is more severe than PCOD and should be managed with great care. So again, I would like to mention that PCOD can be managed through lifestyle changes, diet, regular yoga practices and exercises. But to manage PCOS, you need lifestyle changes, diet, regular practice of yoga or other form of exercises, plus medical intervention like hormonal therapy, insulin management, etc. So I am displaying a table which is showing the differences between PCOD and PCOS. You can once go through the table to see the differences. Let's talk about the role of diet in case of PCOD and PCOS. So diet plays a major role to manage PCOD and PCOS. So in PCOD and PCOS, due to the insulin resistance, the insulin's levels are higher than normal. So insulin resistance causes high insulin levels. That's why we should focus on the foods having low glycemic index or GI index and the foods which are having anti-inflammatory properties. So the foods with low glycemic index doesn't cause the insulin level to rise quickly, and such foods are whole grains, nuts, legumes, fruits, oats, brown rice, lentils and millets. In your diet you can add lean proteins, and some examples of plant-based lean proteins are tofu, beans, lentils, chickpeas. Among the anti-inflammatory foods you can have walnuts, almond, flax seed, chia seed, sunflower seeds, avocado, olives. And among the cold pressed oil you can have coconut oil, then olive oil, leafy greens, berries, tomatoes, ginger, turmeric and green tea, which are having anti-inflammatory properties. So your diet must include the foods which are organic, natural and not refined. You can include leafy vegetables in your diet, fruits, grapes, berries, cherries, etc. Sometimes you can have dark chocolates which are rich in magnesium and antioxidants, which reduces inflammation. And there are some foods which you have to avoid to manage PCOD and PCOS, and these includes white bread, refined flour, fried or processed foods or meats, junk food, sweets, soft drinks, packaged foods, white sugar. Also the bakery items, carbonated beverages and red meats, and high amount of oil and spices. Let's discuss about the role of yoga to manage PCOD and PCOS. So yogic practices have a positive impact or effect on PCOD or PCOS by addressing both physical and mental conditions. PCOD and PCOS is caused due to hormonal imbalance, insulin resistance or lifestyle and stress, and all these areas are addressed by yoga practices. So yoga plays a supportive role. So how does yoga practices help in managing PCOD and PCOS? Number 1, yoga practices improve the hormonal balance. Yoga helps to regulate endocrine system, and there are certain poses in yoga which can stimulate your thyroid glands, supporting better hormonal function. Number 2, regular practice of yoga can reduce stress and anxiety. Stress always leads to high levels of cortisol level, which eventually worsen the PCOD condition or symptoms. Breathing practices or exercises, then pranayam, then meditation can lower stress hormones, promoting emotional stability and better menstrual health. Number 3 is weight management. So obesity is also an important cause of PCOD and PCOS, and regular practice of yoga can improve your metabolism, reduce fat and reduce body weight. That's why keep practicing yoga regularly. Number 4, yoga also improve insulin sensitivity, so it can help to regulate insulin level. Number 5, yoga practices can improve your reproductive health. There are certain asanas in yoga which can stimulate the pelvic region, improving blood circulation to reproductive organs and possibly restoring ovulation. So along with medical treatment, If you can manage your diet, modify your lifestyle, and keep practicing yoga regularly, you can manage PCOD and PCOS. In the next video, I will be demonstrating the entire yoga sessions or yoga module or yoga practices to manage PCOD and PCOS. Till then, stay tuned. Namaste.